Hello, everyone. Welcome to Ed Series Podcast. Today, we're going to be looking at the topic Public Health Solutions to Combat Climate Change Problems, Part 1. Much of the conversations around climate change centers on things like lowering carbon emission, which is obviously critical. I think the public health response to climate change should be a much larger conversation. Whatever we do moving forward to address climate change, there is no avoiding the fact that we still face consequences. That sucks. But we soften the blow if we prepare ourselves.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.
Mitigation and adaptation are major components of public health preparedness, and both are relevant to a health-focused approach to climate change mitigation. Mainly encompasses efforts to slow down or reverse climate change, which will largely depend on policies made outside of the health sector. In 1994, a committee of health-minded professionals get together and developed the 10 essential services of public health. The first essential service is to assess and monitor population health in light of the role of climate change. This means tackling changes in health and disease trends on a warming planet. The second service is to investigate, diagnose, and address health hazard and root causes. This means investigating health diseases outbreaks that result from climate change. This includes waterborne diseases, foodborne diseases, and diseases spread by vectors like mosquitoes and ticks, all of which are increasing as the planet warms up. Third service is to communicate effectively to inform, and educate. This requires public health officials to learn and practice effective communication techniques to keep the public aware and informed about health effect of climate change. Maybe focused on getting this information to the public via conventional media such as radios and televisions, and equally via social media platforms. The fourth service is to strengthen support and mobilize communities partnerships. This one's about collaboration, nurturing relationship with both industry and communities, and providing needed support for their effort to create and implement climate solutions. The fifth service is to create, champion, and implement policies, plans, and laws climate related. Example of this one will be the creation of plans such as municipal heat wave preparedness plan that is ready to go in the case of a severe heat. Sixth service is to utilize legal and regulatory actions. This one gets a little tricky because it's a balance between creating healthy conditions and respecting people's autonomy and interest. Because pretty familiar with this tricky relationship is the COVID-19 pandemic, and the same tension start to arise in matters of climate change. Legal measures taken to protect health and a warming planet may not always be warmly received, and it will take work to find the right balance. The seventh service is to enable equitable access. This steps requires that health services be provided in an effort to prevent or address the health effect of climate-related disasters. Careful consideration would be necessary to ensure that these services are provided equitably, not just to developed countries or rich neighborhoods already suffer less from climate change, but to nations, developing countries, and very poor rural areas, which are traditionally have low access to healthcare and far fewer protections against disasters. Its service is to build the diverse and skilled work, mainly refers to the training of health providers that are educated about relationship between health and climate change and have the skills to educate their patients about relationship to identify and address health issues that individual patients may face. The ninth service is to improve and innovate through evaluation, research, and quality. This one might be my favorite, mainly because it calls for more research. Absolutely, there's need for more research to understand the health effect of climate change and the best ways to address it. Finally, the 10th service is to build and maintain a strong organizational infrastructure for public health institutions. A strong public health infrastructure is critical to our ability to respond appropriately to public health climate change, which should be included in our pandemic response. We've got some work to do here, guys. Um, would appreciate if you like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. Thanks for listening.